Okay. Hi Charis, my name is Giuliana and I'm your sports massage therapist for today. How can I help you?
I'm here because I have a bit of tightness in my legs. I'm a badminton player. And I've recently been selected to play for the national team.
Oh, congratulations.
Oh, thank you. And I have increased my activities a little bit, I think, than usually. And I get this tightness when I go into a range of movements, especially when I do lunges.
There's lots of lunging, isn't there?
Yeah,
I used to play myself.
Yeah. So, and I just here for the massage, really.
Okay, all right. Have you had sports massage before?
Yes, I had one before. It was wonderful. That's why I'm here again.
All right. All right. Lovely. I'll ask you a few more questions.
Go on.
And also, thank you for filling the form before. I can see there's no past medical history that we need to be concerned about. I can see no recent surgeries and no sort of traumatic events to ankles, knees and hips on either side,
nothing,
right?
Yeah,
okay.
No, I never had a trauma. I was lucky enough, I think.
And I can see that you work as a shop worker as well, so you're on your feet a lot, you use your legs a lot, don't you? All right. And in your form, you mentioned that you have tightness at arms, back, hips and legs.
Yeah.
But you just mentioned legs now. Is that the area that you want to focus on?
I think I want to focus more on the thighs here, the front, the back.
Okay,
front
and
tight.
back.
Yeah, that's what I think. Yeah.
Okay.
Tightness.
All right. So you've been selected for the national team. So have you? Did you say that you've increased the level of your
Yes,
training?
I used to do like 2 or 3 times.
Okay.
And now I'm doing for like 5 times.
Okay. So
also, I had a bit more time in the past, and I was more kind of religious with my stretching. But nowadays, seems I'm a bit lacking on that side.
Okay, so you're going sort of straight in.
Yeah.
All right. Okay.
It's not straight, but I have decreased it a bit, let's say. Or sometimes I may avoid it, sometimes no.
Okay. So are you cutting a little bit corners in terms of your recovery habits?
Yes.
Okay. All right. I understand. And are you training still in the same court?
Yes. Nothing has
that's
changed.
not changed. The floors hasn't changed.
No.
And the shoes are the same?
Shoes are the same.
Both at work and at badminton.
Yeah. Nothing has changed there. Yeah.
And has the tightness kind of started as you increased your training?
Yes, I had that in the past.
Okay.
I think that's why I had the massage in the past and it worked for me.
Okay.
So a similar thing,
Okay.
tightness.
All right. And I mean, national level, wow, well done. I imagine that feels a little bit more responsibility.
I think that's part of the problem.
You?
That's what a bit of stress, and I'm pushing myself into the limits. Yeah.
Okay.
Because I want to be on the best of my ability, ready to perform on that level. Yeah.
Okay. So are you sleeping well enough?
Sleep is not affected. I'm sleeping well. Yeah. No issues there.
So throughout you mentioned tightness. You haven't mentioned pain. So am I correct? That
so no pains, nothing there is just this tightness that I have around there.
Okay.
Yeah.
And pins and needles down the leg,
No
sharp shooting pain, none of that. Okay.
Yeah.
And the discomfort between 1 and 10, 10 being the worst.
I wouldn't call it as pain or I would call it tightness. If I have to give you a number now, I'll maybe go for 2 or 3 out of 10.
Okay. Yeah. All right. Okay.
So it's nothing significant to worry. It's just for me to make a bit more loosen in that area. Yeah.
And you're sleeping well, and you're not restricting anything from your diet.
No, everything's fine.
Okay, all right.
Still all the same.
Okay. Shall we have a look a little bit at the
course.
legs? Muscle testing, muscle lengthening.
Okay.
You mentioned lower back, so we'll quickly have a look at the lower back. Come and stand in front of me. I'll look at posture and symmetry. Lovely. You look pretty symmetrical, no particular difference in muscle back from what I can see here. Can you take a walk up and down this corridor for me? Good. No pain in any way as you do this. Good. Turn around facing me. Good. And folding forwards. How far can you go? Where do the
I feel the tightness.
Okay, the tightness, But good range, really. But tight at the back of it.
I used to touch the floor.
Okay. Very flexible. I see. Hands behind your back like so. And then chest up to the sky for me. Good. Sorry, I didn't see that. Can I do it again? Lovely. Okay. Again. This one, no tightness. Arms along trunk. And then side to side. Lovely. Okay. Give yourself a cuddle. And then side to side. Good. No problems with these two movements, right? Okay. Lovely. All right. So just put this clean towel and the clean headrest here for you. Could you please come and lie on the bed?
Do you want me on my back or my front?
On your belly up, please.
Okay.
Belly up, please. And for the purpose of the video, we're going to just work on this side. Yeah, it'll be this side both for prone and supine positioning as part of the test, okay? All right, so back into the assessment. So Charis, as part of massage therapy, we use touch. Is that okay?
That's fine, yeah.
Good.
Go ahead.
All right, okay. So, first of all, I'm going to take hold of your leg, right? And then good range for this one, lovely. And this one, good, feels a bit tight, yes.
Yeah.
This one feels okay. All right, and then this comes over and across. Good, this way.
Yeah, tighten this side then.
Okay, yeah. And then I'm going to put this leg on this side of my body.
Yeah, my
yeah, a bit tight here. Yeah. Okay, it feels like this. All right. Okay. I'm just going to test your hamstrings.
Okay.
Length of your hamstrings.
Okay.
Good.
Yeah, a bit tight.
Yeah.
Yes.
Yeah, a bit tight. Yeah. And I would test the other side, of course, as part of the test. Can I test your hamstring strength? I'm going to bring this leg up. Good, like so, and then press through your heels. Lift the bottom. Good, good, good. Okay, all right, and back down. We're going to do this again, Harris. And I'm going to place my hands behind your heels and then kind of pull them towards me. You need to resist. Don't let me move.
That's fine, don't worry.
Yeah?
I will do that.
Bottom up, please. Good. And then resist me. Aha. Okay, hamstrings are a little bit weak, I can see. All right, in your own time, come and sit on the edge of the bed on this end of the bed for me. Good. I'll do quads, yeah, hip flexor actually. All right, roll back down and give your knees a squeeze.
Oh gosh.
Good, good, good. And now squeeze only this knee here and release this leg for me. Okay. All right. Okay, yes, a little bit touching. A little bit tight. Aha, yes, rec fem. Okay, give the knees a squeeze again. And in your own time, come and sit at the edge of the bed and we'll have a little conversation how I can help.
Oh gosh.
Good, come and sit on this chair again. All right. Okay, so yes, I can confirm through testing that there seems to be no acute injury that we need to be concerned of. So it seems to me that, I think you were sensing the same, that due to the increased training, there's been some sort of training-induced muscular tightness, a bit like Dom's type of stiffness. Yeah,
I agree
and this
with
is
you,
due to probably the high frequencies and lunges that you're having to perform now. A little bit of kind of cutting corners, maybe with recovery habits, and for sure due to the increased training volume. So there's quite a bit of weakness as well at the hamstrings that I can see, definitely tightness at the hamstrings and tightness at the quads. And a little bit of tightness as well in the external rotator, hip rotator musculature as well. So I think that given that there's no evidence of acute injury, sports massage can be indicated for recovery and mobility.
Sounds good,
yeah?
That's why I'm here.
Brilliant. So I have your consent for treatment.
Oh yes, definitely.
Sports massage, requires touch, so that's okay.
That's fine. Yeah.
All right, lovely. Okay, let's do it then. Come, pop yourself back on the bed. Let's start working with the quads at the front and hip flexors.
Okay. Do you want me to lay on my back or my front?
So belly up.
Belly up, okay. Oh, okay.
Okay, and extend both legs. And we're going to place the towel here. So if you're lying for a long time, your body temperature will drop. If you feel cold at any time and it didn't any point of the treatment intervention, just let me know. I can turn the heating on. I can bring another blanket, or if the amount, so throughout the intervention there'll be different levels of pressure through my hands, and sometimes I'd use forearms as well. If the pressure feels too much or even too little, please let me know and we'll adjust accordingly. So you need to be comfortable at all times, really. Okay, all right. Okay, so I'm going to tuck in. We're going to, do this leg for the video as well. It will always be this side that we use. And I'm just going to tuck the towel at the seam of your trousers. Is that okay?
Got the beginning to do it, please. I'm comfortable with that. I have previous massage.
Yeah, you've had quite a lot of massage.
Yes.
Okay, perfect. All right. Okay. So we're going to start warming up the area. So I'll start working in quite superficially with effleurage, yes?
Yes, that's fine.
Okay. Good. We're working longitudinally. And through effleurage, we are sort of calming down a little bit the nervous system, and we're stimulating basically the superficial level of the skin. With quite light touch initially. We could work with a little bit of vibration as well to warm up the area and bring some soothing again to the nervous system. Yeah, and then again, we'll provide some effleurage. As the area starts feeling warmer and the muscles start to relax, we can use a reinforced technique, for example, like so, where one hand reinforces the other. Or I could be using the V shape, for example, and I obviously apply pressure as I go up, and then less pressure in the recovery phase. So I'm working on the quads and hip flexor, in this case the rec fem. And again, I pepper it again with a bit of a lighter effleurage as I change the techniques. Yeah, as the muscle starts feeling more relaxed and the area becomes warm, I can then move into pétrissage. So pétrissage is a technique that uses squeezing and lifting of the belly muscle, and by doing so we're bending the tendons, stimulating the Golgi tendon, yeah, and therefore reaping benefits from reflex inhibition. So for this one, yeah, I can do ringing, which is for the video, this, yeah, or sort of more literally kneading, like so, which means I'm kind of pulling and pushing up the belly muscle, and then kneading again, yeah, which is this move, ringing, which is this movement, okay? Peppering again in between techniques with effleurage. Good. So after effleurage and pétrissage, I can move into deeper techniques. So for example, at the quad, I could use soft tissue release. In this case, I'm going to take hold of your leg, Harris, and I'm going to release the lower bit of the leg, yeah, because I'm working at hip flexors and quads, yeah, the quads obviously extend the knee. So the way we're going to do soft tissue release, so pin and strike, yeah, I'm going to passively at the beginning extend the knee and then use pin, lock, good, and then I'm going to bend the knee and provide length like so. Yeah, I like to use the forearm, or I could also use, for example, knuckles. And when I feel ready, I could, for example, ask the client to do this actively. So, Harris, I will ask you to bring the knee in extension. I can provide lock, and then gently we work together. You bend the knee. Good. And again, lock, and then gently bend the knee. So that's a technique I can use. Good. Another technique I can use is PNF, reaping the benefits of PNF. So for this one, I could put literally my knee. Yeah, I could use my knee on Harris's lower leg, and Harris will be active for this one. Harris, you will push your your lower leg into my knee. Push for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then relax for 10 seconds, and then Harris, you'll be experiencing an increase in range, probably feeling a little bit of a stretch at the front of the thighs. 3, 2, 1. And we can do this twice more, for example. So Harris, please press into my knee. Yeah, for 10 seconds. And then after 10 seconds, you release for another 10 seconds. And then you'll experience a little bit more stretch at the front of the thigh. Lovely. I can see the benefits of this stretch already on you. Perfect. All right. Once this is done, I'll bring the leg back. And I think this would be my work finished at the anterior compartment of the thigh, the quads. So we can then do the back of the leg, focusing maybe on the hamstrings and maybe a little bit of the external internal gluteal muscles. All right. So Harris, in your own time, I'm going to hold on the towel, and then you can roll and come into onto your belly.
Oh God.
Okay, perfect. So for the purpose of the video now, obviously this is Harris's left side, but we'll still work on this side, otherwise it won't be visible what I do. All right, so Harris, how are you feeling? Are you warm? Good. And the level of pressure that I was using, was that comfortable? Yeah, were you feeling the stretches and the lengthening of the muscles? Good. All right. Okay, so again, I'm going to tuck the towel on this under the seam of your shorts. Is that okay? Okay, and we'll work on your on the hamstrings and maybe a little bit of the gluteal muscles as well. Yes, I'm just going to tuck this right in. So we'll start with hamstrings first. Okay. All right. So hamstrings. With the hamstrings, we can do the same, really. Yeah, we'll start with some, effleurage. Starting making contact so the patient can feel comfortable. I like to use a little bit vibration at the beginning. Again, it has a soothing effect, vibration. And then into effleurage, just like at the quads, really. Yeah, effleurage, reinforced effleurage, reinforced effleurage. Good. Again, you could use the V shape, cam and spindle. Yeah. Good. Lovely. And as you kind of delve deeper, you might find some sort of knotty areas, and we can do a bit of trigger point. So for example here, yeah, and you can apply a bit of reinforced thumb here, pressing. 10 seconds, breathing in and out, and in and out. Good. One last time, in and out. And as you keep pressure on trigger points, one will feel sort of the muscle relaxing, benefiting from compression, and benefit for that moment of hypoxia. And then as you leave, the blood and oxygen serving again muscle tissue, because trigger point is basically oxygen starvation and removal of waste starvation, isn't it? Okay, peppering the whole treatment obviously with effleurage. Now in terms of soft tissue release, what we can do here, we can start passively again. So we're working on the hamstrings. So we want to bend the knee because the hamstrings cross two joints. Yeah, they extend the hips and they bend the knees. So we're bending the knee, applying a little bit of pressure. I like to work with my forearm. Yeah, and then gently as you lengthen, you extend. Good. And again, up, apply pressure, and then extend. Good. And then the patient can do this, the client can do this more actively. So Harris, you're going to bend the knee, I'll apply the lock, and then extend, extend, extend. Working together. You can also change. You can work with your knuckles. Good. One more time. Lock, and then up, 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 up. And obviously we've got 3 hamstrings, so you're working in the direction of the fibers of each muscle. Yeah. Now we notice a little bit of stiffness as well in the rotation of the hip. So I'm just going to come a little bit higher on the gluteal area. Harris, I'm tucking in. Is that okay?
Yeah, that's fine.
Is the pressure still okay and you're not cold?
No, I'm fine.
Okay. So again, we'll warm up a little bit more. the gluteal area with some effleurage and pétrissage, just as described. But what I find really works for the rotator muscles, basically, hip rotating muscles, is soft tissue release, really. So again, passively I'll bend that knee, yeah, and I'll just kind of internal and external rotate a little bit. Good. And then again, we can, find the range, engage the contraction of the muscle, pin, and then slowly lengthen, lengthen, lengthen. Good. And again, pin, and lengthen, lengthen, lengthen. Good. And then pin, and then lengthen, lengthen, lengthen. Good. And obviously peppering longitudinally with effleurage. Good. Once. Reinforce technique. Palm and spindle. I can use the forearm.
Oh.
A bit too much?
Yeah, it's okay.
Sorry.
It's nice. No, it's okay. It's nice.
Was it nice? Okay. Again, keep communicating with me if it feels too much.
No, it's fine.
You need
I
to
just like that deep massage. Yeah, it's good.
Good. Good. All right. And then just finishing the treatment with some effleurage. Some effleurage. So sometimes massage does bring up emotion. That's totally fine. Taris, don't worry if you feel you need to release some emotion.
Yeah, that's fine.
That often happens with my clients. Not my clients, with clients I know that often can also happen. You just keep communicating. If it feels too much pressure, you let me know. Okay, so with some flushing and effleurage we finish. Yeah, and then we can cover a little bit, broadening the muscle along the bone to create some compression. We know that muscle, in order to find resting length, it needs to contract before it can find some lengthening again. So compression also helps with this. Lovely. Perfect. So the massage part is now finished, Charis. In your own time, come up to a seated position onto the plinth, please. I'll take this up so you can come. Okay. All right. How are you feeling?
Oh, much better. I feel much looser now.
Yeah?
Yeah.
Nice. Okay, lovely. Should we do a bit of testing to see if we can to see if it works? You're sitting already in the perfect position.
Can I have that tissue, please?
Oh yeah.
Thank
There
you
you
so
go.
much.
Okay, good. So just like we did at the beginning, yeah, let's test the length of your quads. So roll down, give your knees a squeeze. Lovely. And then release this. So we can see now the whole back of your thighs are actually touching the plinth. This wasn't happening at the beginning. Yeah, so we've increased a little bit of the length of your quads. Lovely. How's it feeling?
It's feeling very good.
Good.
Actually.
And
yeah.
if I do this, does that feel okay?
Yeah, that's fine.
Good. Lovely. All right. And from there, you can stay there. I will test your hamstring length now. Good. Lovely. Another little ankle test. Yeah, so that has increased the extension of the knee. So hamstrings have lengthened through our massage. Lovely. Okay. Tarits, in your own time, come and sit here, this chair here in cubicle. Good. Lovely. All right. Okay. Yes. I know. Massage can bring out my.
Oh yes, it's very good.
Are you
yeah,
okay?
Yeah, I'm fine.
Okay, lovely. Okay, so through objective testing, we can see that we've created some length of the quads and hamstrings. Yeah. You also reported some sort of kind of a feeling maybe of spaciousness.
Yes, yes, I feel much looser. Yeah, it's good.
Okay,
yeah.
lovely. So you responded well to massage. Now, I guess for today, don't do anything strenuous. You're not training, right?
No.
Tonight. Okay,
No.
you can take rest, drink lots of water. Yeah, and I do recommend that you have a look a little bit at your recovery habits. I don't know if you have a physio maybe as part of your team. They can give you some advice, but definitely you want to stretch those hamstrings. Yeah, I could, for example, simple way of stretching the hamstring is just placing the heel onto the chair. I can show it here. It doesn't have to be this high, it can be a lower chair. Bring the toes to the nose and gently hinging at the hips. That will give you a lovely hamstring
Yeah, I've been
stretch.
doing that. Yeah, I know that. I haven't been doing it recently because I skipped it, but I know the technique.
Good. Yeah, 30 seconds. Yeah,
That's
before.
how I usually use it. Yeah.
Lovely. Yeah, quads, you know, you can stretch like this. Yeah, just with the camera. This one. Good. You want to engage your lower belly muscles to make sure that you target your quads. So do probably a bit of these, and of course also internal rotating muscles, for example, internal and external. You can do your figure of fours. You can do this in seated. Yeah, superflex the toes to the nose and then hinge forwards at the hips. So I do recommend that you do these stretch. Some clients find very helpful to do some foam rolling. Again, you can ask your physio, for example, for some of these stretches. I did find that your hamstrings are quite weak. Yeah, you couldn't resist my strength. So I think you'd benefit from bridging, especially on that right leg. You can start slowly. Again, ask advice from your physio to give you a bit of a program for your strengthening of the hamstrings. I advise, obviously they'll make their own assessment, but a little bit of stretching for your recovery program.
Okay, thank you so much. Yeah.
You're welcome.
Yeah.
Okay.
Have a nice day.
You too. Thank you.